Hello, my name is Samantha Rodriguez, and today I will be talking to you about breastfeeding. So first off, here's an overview of what we'll be talking about today. The first thing is a brief history of breastfeeding, and then we'll be going over general facts about breastfeeding and research, and then we'll get into the benefits of breastfeeding for the baby, as well as benefits of breastfeeding for the mother, and then we're going to talk a little bit about breastfeeding in public and how it's so controversial. Brief history of breastfeeding. For many years, hospitals were in favor of bottle feeding over breastfeeding. However, recently the World Health Organization and the United Nations Children's Fund is reversing this trend. The way they're doing that is by putting baby-friendly programs in many impoverished countries. The advantages of these programs are effective, but we do need to balance these advantages with the risk of HIV transmission, which, as I'm sure many of you know, HIV is really common in impoverished countries. Next are some general facts about breastfeeding. Human milk or alternative formula is the baby's source of nutrition for the first 4 to 6 months of life. So this, of course, babies don't have teeth, so they can't eat like we do. So this is pretty obvious right here. A recent analysis shows breastfeeding is actually better than bottle feeding, and this is for many reasons, which we'll get into later on. In 2009, about 77% of moms breastfed their newborns. This number dropped by 30% for 6-month-olds, where 47% of moms breastfed 6-month-olds. Some more general facts on breastfeeding. The AAP work group on breastfeeding endorsed breastfeeding during the first year of life. However, these mothers should not breastfeed if they are infected with the virus that can be transmitted through breast milk. Some examples would be like HIV, which we talked about earlier, and active tuberculosis, as those diseases, I'm sure you all know, are really deadly. And they also should not breastfeed if they're going to be taking any drug that's unsafe for infants. And then early weaning to inadequate sources of nutrients, like unsuitable and unsanitary cow's milk, can actually lead to protein deficiency and malnutrition in babies. So that's why you have to be careful and make sure that your baby's getting the nutrition that they need so they can grow and develop properly. The American Academy of Pediatrics section on breastfeeding. So they actually recommend breastfeeding exclusively during the first 6 months of life. They also say that after 6 months, breastfeeding can be continued as a complementary food along with other like baby food and things like that. And then mothers can also continue breastfeeding for up to a year or longer if they desire to do so. That's a choice between the mom and baby. So next we're going to get into some research on breastfeeding. So research has showed that mothers who are less likely to breastfeed are mothers who work full-time outside the home, which, sometimes they might not be able to have time or they can't afford a breast pump or whatever the reason may be. Also shows that mothers under 25 years old tend to not breastfeed. And then also mothers who do not have a high school education, and mothers of African American descent, and mothers of low income socioeconomic status. Let's keep in mind that mothers that fit these categories, that they don't breastfeed, because some of them do. It's possible. But these are the mothers that tend to not actually breastfeed, according to research has been showing us. So here's some more research on breastfeeding. However, they found that mothers who are more likely to breastfeed tend to be more wealthier, which explains maybe they can afford a pump if they do go to work. They also tend to be older and more educated. As you can see, the more educated you are in breastfeeding, the more you're likely you're actually going to do it. And these mothers are likely more health conscious than their non-breastfeeding counterparts. So, this explains why breastfed children tend to be healthier. Since the mother's healthier, of course, that's going to lead to the baby healthier. And here's some more research on breastfeeding. Breastfeeding mothers who do return to work tend to use breast pumps. So far, there have been no psychological differences between breastfed and formula-fed babies. They're still looking into studies on that. And then breastfeeding versus bottle feeding studies are correlational and not experimental. So let's always keep that in mind. Right here is just a picture of a breast pump. There are many brands you can choose from. There are many types. It's completely up to the mother. Next is a study that is found in the children textbook by John Sandrock on page 135. So in the study, the participants were low-income mothers from Georgia. These mothers received interventions on breastfeeding, like counseling that focused on the benefits of it, and they also included a loan of a breast pump so that the mothers can use. The study found that these interventions actually increased breastfeeding among these mothers. Okay, so this is a video on breastfeeding and its benefits. I wasn't able to play it for you because for some reason my computer the sound was really poor. You couldn't hear anything. I couldn't figure out how to fix it. So I just added the link that you can look up. Well, basically what it talks about is how women who breastfed had a lower incidence of breast cancer, which is really beneficial since we all know that breast cancer affects many women. And it also gives some benefits of breastfeeding for the baby, as well as benefits of breastfeeding for the mother. And I also go over these benefits in the next few slides. But like I said, if you have some time, later on or whenever, this video is it's a short video, but it's really informational. So now we're going to go ahead and take a look at the benefits of breastfeeding. First off, we're going to look at benefits for the baby. So a few of these benefits include the babies tend to experience fewer gastrointestinal infections, like stomach viruses and things like that. They also tend to experience fewer lower respiratory tract infections, which are really common around the wintertime and fall time. It also reduces wheezing during the first 3 months of the baby's life. And these babies are also less likely to get middle ear infections, which can actually be common in young children. And here are some more benefits of breastfeeding for the baby. These babies are less likely to be overweight or obese during childhood, adolescence, and adulthood. So basically throughout the whole lifespan, these babies tend to not be overweight, which is a good thing because especially in today's society, this is a really huge problem with all the fast food. And these babies are also less likely to develop type 1 diabetes during childhood and type 2 diabetes during adulthood. These babies are also less likely to experience sudden infant death syndrome, or also known as SIDS. And there's actually evidence of benefits for cognitive development and the cardiovascular system, which is great. And then a few more benefits of breastfeeding for the baby include that breast milk contains adequate nutrition for the baby, and it contains things like vitamins, proteins, and fats, which are essential to help a baby grow. Breast milk also contains antibodies to help fight off viruses and bacteria, which explains the last few slides about how these babies tend to not experience infections. And then breast milk is also more easily digested than formula. And some more benefits of breastfeeding for the baby. These babies tend to have a lower risk of asthma and allergies. Breastfeeding is actually linked to higher IQ scores in later childhood, which is something I found pretty interesting. And then the skin-to-skin contact and eye contact helps the mom and baby bond, and this leads to a sense of security for the baby, which is really important. And here's just a little picture about the breastfed baby. So for the immune system, these babies tend to respond better to vaccinations, and the human milk helps to mature the immune system. And also, another thing I found interesting is that these babies tend to have a decreased risk of childhood cancer. For the skin, these babies have a lower incidence of allergic eczema. For the joints and muscles, juvenile rheumatoid arthritis is less common in babies who are breastfed. For the throat, these children who are breastfed are less likely to require tonsillectomies, which is the removal of the tonsils. And for the ears, like we mentioned earlier, babies who are breastfed tend to get fewer ear infections. For the eyes, visual acuity is higher in babies fed human milk than their formula-fed counterparts. And like mentioned earlier, breast milk or breastfeeding is linked with a higher IQ in childhood. And for the endocrine system, they tend to have a reduced risk of getting diabetes, which was also mentioned earlier. For the mouth, they have a less need for orthodontics in children who are breastfed. They also have improved muscle development of the face from sucking at the breast. And they also have subtle changes in the taste of human milk, which helps prepare the babies to accept a variety of solid foods when they grow their teeth in. They're able to eat solid foods. For the respiratory system, they have fewer and less severe upper respiratory infections and less wheezing, less pneumonia, and less influenza, which can be very bad if a baby gets any of those infections. For the heart and circulatory system, breastfed children have lower cholesterol as adults, and the heart rates are also lower in breastfed infants. For the digestive system, these babies tend to experience less diarrhea, fewer gastrointestinal infections, and also reduces the risk of food allergies, which is something I found pretty interesting. And there's also less risk of Crohn's disease and ulcerative colitis in adulthood for these babies who are breastfed. For the kidneys, human milk is easier on the baby's kidneys. The appendix, children with acute appendicitis are less likely to have been breastfed. For the urinary tract, they tend to experience fewer infections there as well. And the bowels, they also tend to experience less constipation, which can lead to the baby feeling more comfortable in moving their bowel movements. Okay, so now we're going to get into the benefits of breastfeeding for mom. So some physiological effects of breastfeeding include when a mom breastfeeds, she releases oxytocin, which produces uterine contractions. And these uterine contractions lead to uterine involution, which is basically the return of a non-pregnant state. It also delays the return of menstrual periods, decreases the risk of iron deficiency. And one thing I found really interesting is that there is a birth control method called lactational amenorrhea method, or LAM, and it's 98% to 99% effective in preventing pregnancy during the first 6 months, so they don't have to worry about getting pregnant while they're breastfeeding. Some long-term effects include reduces the risk for 3 of the most serious diseases for women, which include female cancers, heart disease, and osteoporosis. Moms who breastfeed also have an advantage on losing weight gain during pregnancy, and they also tend to have lower sugar levels in mothers who have type 1 diabetes prior to getting pregnant and mothers with a history of gestational diabetes, which of course is diabetes that occurs only during pregnancy. Some more long-term effects include they tend to have higher levels of high-density cholesterol, which is actually the healthy cholesterol that we need. And after weaning, bone density returns to pre-pregnancy or higher levels, leading to stronger bones, which reduces the risk of osteoporosis. And these women also have a reduced risk of ovarian and uterine cancer. And then 3 of these benefits to remember is that women who breastfeed have a lower incidence of breast cancer, they have a reduction in ovarian cancer, and a small reduction in type 2 diabetes. Okay, so like I mentioned earlier, I wasn't able to play any videos for this presentation, But here's another short video. It basically talks about breastfeeding in public and how it's so controversial. It also, well, it actually shows a clip of a lady who's breastfeeding. I want to say it's in a Target. And a man starts harassing her and just cussing at her. And then there's women who stand up for her. And it's pretty crazy to watch. But like I said, for the last video, if you have time, you can look up this video. And another thing too is the reporters actually talk to different people like on the streets, like on their opinions of breastfeeding in public. Okay, so breastfeeding in public controversy. So according to a poll on debate.org, 36% of people said that breastfeeding in public is not appropriate. The remaining 64% said breastfeeding in public is appropriate. And the primary reason why people say breastfeeding in public is inappropriate is because they find it to be indecent. So I found some arguments against breastfeeding in public. Of course, there's many more, but here's just a few. So one of them is public nursing can be dangerous. These people said that basically mothers who breastfeed in public tend to experience harassment and assault. It also creates awkward social interactions. They consider the breast to be, how would I say, like a private part. And if a kid sees that, they might say, yes, whoever they're with, what are they doing? They also say it's an intimate act that has no place in public. They say it's actually physically and emotionally intimate. And they also say public nursing may not be legal. However, they don't, some people know and some people don't know, but many states actually have laws protecting women breastfeeding in public. And here's a few arguments for those who are in favor of breastfeeding in public or who find it appropriate and aren't bothered by it. So one of them is they say were made to feed babies. And they say that today's society over sexualizes breasts, and that's why some people get offended by breastfeeding in public. They also say that newborns need to be fed every 3 hours or so, just depending, and these babies are not like on clockwork. If a baby needs to eat, a baby needs to eat. And one of the other biggest ones I found was that it's the mother's choice. Like ultimately it's up to the mother if she wants to breastfeed in public or not. Okay, so this was the last video that I had tried to play for you. And again, I was unable to play this one. It's really unfortunate because I really like these videos and they were really short. Like this one's only right under 2 minutes long. But this one just talks about breastfeeding in public and it has 4 different women arguing on their views about breastfeeding. It's kind of like a little debate and even the audience they don't get involved, but they clap along with who they agree with. It's pretty interesting to see, different women who have kids argue about this issue. But like I said on the other 2 videos, if you have time, here's the link and this is how it looks. So you're more than welcome to look it up on your free time. So that way you can just see for yourself what it's about. Okay, so here are the 5 things to remember about this presentation. The first one is that for many years, hospitals were in favor of bottle feeding over breastfeeding. You can find this on page 124 of your textbook. The next one is that human milk or alternative formula is the baby's source of nutrition for the first 4 to 6 months of life, which is found on page 133 of your textbook. Breastfeeding versus bottle feeding studies are correlational and not experimental. This is found on page 135 of the textbook. And the benefits of breastfeeding for babies show evidence of benefits for cognitive development and the cardiovascular system. This is found on page 135 of your textbook. And last but not least, the benefits of breastfeeding for mom include lower incidence of breast cancer, reduction in ovarian cancers, and a small reduction in type 2 diabetes, which can also be found on page 135 of your textbook. And then here's just a list of some references. Here's more references. And our textbook is at the very bottom, so you can see. And thank you for taking the time to go through this presentation with me.